It's time for another warm-up. Let's get going. Activation of fibroblast growth factor receptor 3 is associated with what disorder? So FGF receptor 3 is going to be achondroplasia. Next, a football player who was kicked in the leg suffers from a damaged lateral meniscus. Well, what else is likely to have been damaged? So this could be the unhappy triad. So that could be the ACL, the MCL. Those two can be injured there. Next, what is the basic equation for cardiac output? What is the Fick principle? So cardiac output equals heart rate times stroke volume. And then what is that Fick principle? So the Fick principle says that your cardiac output is equal to the rate of oxygen consumption divided by the difference between your arterial and venous O2 content. All right, that's it for the warm-up. Let's get to that lecture now.
Hello everyone, and welcome to our Step 1 lecture on spirochetes and zoonotics. Now there is some good stuff in this lecture, so let's just get going. Spirochetes are spiral-shaped bacteria, and they achieve this spiral shape by having axial filaments, which are like flagella but oriented differently. These axial filaments run the length of the bacterium and allow for a rotating motion. We're going to talk about a few spirochetes today that are pathogenic to humans and important for your test, including Leptospira, Borrelia burgdorferi, and Treponema pallidum. So let's start with Leptospira interrogans. Leptospira is a spiral-shaped bacteria like other spirochetes, but it has a question mark shape at the end of its tail, like you see at the top of this image. One way to remember that this is interrogan sounds like interrogation, and thus that little question mark shape. Leptospira is found in water contaminated with animal urine. Okay, now if you see an infection associated with animal urine on your test, I want you to think of two types of infections. The first one is Leptospira, and the second one, which is associated with rodent urine, is hantavirus. So remember those two. Leptospirosis and hantavirus infection are both associated with urine. Now back to Leptospira. So how does the Leptospira infect a person? Well, when contaminated water comes into contact with mucous membranes, conjunctivae, or breaks in the skin, that's when the Leptospira can enter. The onset of illness is usually abrupt, and it starts with fever, body aches, chills, and headache. Leptospirosis is described as having two phases, though they often overlap in reality. The second phase is the one characterized by hyponatremia, renal failure, and liver damage with jaundice. You can also have aseptic meningitis and pulmonary hemorrhage. Leptospirosis can range from a subclinical disease to a very severe illness resulting in death. This very severe form is sometimes called Weil's disease. We see more of this in developing countries where human exposure to contaminated water sources is more prevalent, but there are definitely cases diagnosed here in the U.S. So how do we diagnose this? We use serology, that is, we look for antibodies to the Leptospira. And we treat this with penicillin, ceftriaxone, or doxycycline. All right, moving on to our next spirochete, Borrelia burgdorferi. Now you can see its spiral shape in this image. Do you know what disease this causes? I suspect that most of you do. This is the spirochete that causes Lyme disease. Now Lyme disease is very high yield for your test, so pay attention in this section. Lyme disease is a very real problem in the U.S., especially up in the Northeast. It's transmitted by the Ixodes tick. It's the most common tick-borne illness in the United States. There are several stages to Lyme disease. Stage 1 is early localized disease. The most characteristic finding at this stage is the skin lesion that's referred to as erythema migrans. Now, this is not the redness that happens as an immediate reaction to the tick saliva. When you can see that same day that you find a tick, you see a little red mark. That's not it. Erythema migrans is a red area that develops at the site of the tick bite after several days and up to 2 weeks after that bite occurred. The redness expands outwards and often has a central clearing in the middle that can be described as a target or a bullseye. The infected person may have other symptoms of a viral illness like fever or headache, body aches, and fatigue. Now, stage 2 is referred to as early disseminated disease, and this occurs weeks to months after that tick bite. This phase results from the blood-borne spread of the spirochete. The first thing that infected people may notice in this phase is the presence of multiple erythema migrans lesions. Cardiac and neurological symptoms can also become apparent in this stage. The cardiac findings include AV nodal block. Lyme carditis is unusual in that the AV block can fluctuate in severity within the same person. going from first degree to second degree to complete heart block, sometimes rapidly, and then regressing back to second or first degree heart block. Other cardiac findings can include myopericarditis. There are also several possible neurological abnormalities in the early disseminated phase of Lyme disease. You can get cranial nerve palsies, especially involving the facial nerve. One finding that's a huge clue to the diagnosis of Lyme is bilateral facial nerve palsy. This doesn't happen in many other disease states. Lyme can also cause peripheral neuropathy or lymphocytic meningitis, among other neurological problems. The third stage of Lyme disease, the late phase, occurs months to years after the tick bite. One manifestation of the disease in this phase is arthritis. The arthritis is typically an intermittent or a chronic arthritis of large joints, especially the knees. The late phase can also have neurological findings. So, how do we treat Lyme disease? Doxycycline, amoxicillin, and ceftriaxone are all used in various stages of that disease. Doxycycline is the drug of choice for early Lyme disease, stage 1 and stage 2 Lyme disease. For children under the age of 8, we use amoxicillin. For early disease, we treat for 10 to 21 days, and for late Lyme disease, you can use doxycycline or ceftriaxone, and it's given for 28 days. Okay, let's move on to the next beautiful but so unpleasant spirochete that we'll be covering today. And this one is Treponema pallidum, the causative organism for syphilis. Syphilis is usually a sexually transmitted disease, but it can also be transmitted from mother to baby during pregnancy. Now, syphilis can get confusing with its multiple stages, just like we just saw with Lyme, but it's also important to know for your test. So let's go through this together. The first phase is called primary syphilis. This phase refers to the local infection that occurs at the site of inoculation. That is where that Treponema pallidum entered the subcutaneous tissues. And this usually happens through small abrasions that occur during sexual activity. And the evidence of that initial infection is an ulcer that's usually solitary and it's painless. This is a huge, huge clue in any question that you see. If they mention a painless ulcer, they are trying to tell you that this is syphilis. Because this ulcer is painless, a lot of people don't ever seek medical attention, and then it just goes away on its own. So people don't ever even think of reporting it to their physician. But the infection doesn't go away when that ulcer disappears. It just moves on to the second phase of the disease, called secondary syphilis. In secondary syphilis, we see the results of the dissemination of that infection. Infected individuals will have nonspecific symptoms like fever and malaise. A slightly more specific sign of secondary syphilis, and definitely the one that you need to remember, is a maculopapular rash involving the palms and the soles. There are a couple of other things that cause rash on the palms and on the soles. First, secondary syphilis can do it, but Rocky Mountain spotted fever can, Coxsackie A virus, and Kawasaki disease. Mnemonic for maculopapular rashes that can affect the hands and feet. You drive Kawasaki cars with your hands and your feet. Yes, I do know that Kawasaki makes motorcycles and ATVs, but it still works here. So Kawasaki disease, the CA in cars is Coxsackie A, the R in cars is Rocky Mountain spotted fever, and the S is secondary syphilis. Okay, back to secondary syphilis. The other common physical finding is large whitish raised areas and moist areas of the body and on mucous membranes, and this is called condyloma lata. Now, if a person still doesn't seek treatment at this point, the infection becomes latent. Early latent syphilis refers to an asymptomatic syphilis infection that was acquired in the last 12 months but hasn't yet been treated. Late latent syphilis means that the patient has had an asymptomatic syphilis infection that was acquired more than 12 months earlier. And lastly, there's tertiary syphilis. This refers to the late complications of syphilis infection. So what specific complications should you know about with tertiary syphilis? Well, you definitely need to know about gummas, as well as the cardiac complications. Okay, so gummas. What the heck are gummas? These are granulomatous lesions that can be found in the skin, in bones, or even in internal organs. What about cardiac complications? What do we see? Well, these often involve the ascending thoracic aorta. Syphilis causes inflammation of the intima, leading to dilation of the aorta and to aortic insufficiency. Now, the neurological complications of syphilis infection are referred to as neurosyphilis. And one important neurological complication to remember is chronic meningitis. Other important complications to remember include general paresis, tabes dorsalis, and Argyll-Robertson pupil. General paresis is a dementing illness that's associated with late syphilis. Tabes dorsalis is a disease of the posterior dorsal columns of the spinal cord and of the dorsal roots. And this leads to sensory ataxia and sudden severe stabs of pain in the body. And this type of pain is described as lancinating pain. Now, tabes dorsalis can also lead to loss of proprioception and vibratory sense in the legs, which leads to repetitive trauma to the joints of the hips and the legs. This repeated trauma can lead to Charcot joint, which is the destruction of that joint over time. We usually only see Charcot joint in diabetic patients at this point in the United States, but it was previously described in syphilis. Now, what about Argyll-Robertson pupil? Well, this is a pupillary abnormality that can be seen with either general paresis or with tabes dorsalis. And what you see on exam is a pupil that constricts with accommodation, but it doesn't react to direct light. Okay, now on to congenital syphilis. This is a super sad situation. Congenital syphilis occurs when a mother has untreated syphilis during pregnancy and the infection is transmitted across the placenta to the baby. This is most often a complication of primary or secondary syphilis in the mother during the time of gestation. So what are the signs that an infant has congenital syphilis? Well, one of the first signs is the snuffles. A blood-tinged nasal discharge that occurs in the first few weeks of life and is more persistent than a cold would be. Congenital syphilis can also result in bossing of the forehead. Bossing just means bulging. You may also see a saddle nose deformity, which is a depression of the bridge of the nose, like what's shown in this image. This image shows another result of congenital syphilis, which is Hutchinson teeth. These are notched, widely spaced teeth like you see here. Another late sign is saber shins. This is where you have an anterior bowing of the tibia. Some of these complications can be averted with early treatment, while others can't be. Now let's talk about diagnosis. To screen for syphilis, we usually start with what's called a non-treponemal test. This would be a VDRL or an RPR. These tests are checking for serum reactivity against a cardiolipin cholesterol lecithin antigen. So this is not specific for syphilis, but usually is present in people with syphilis. These non-treponemal tests are known to have false positives in a variety of other conditions as well, and there's a mnemonic to help remember some of the causes of false positive VRDL or RPR, and the mnemonic is VDRL, which is very convenient. The V stands for viruses, like Epstein-Barr virus. The D stands for drugs, since IV drug users can have a false positive. The R stands for rheumatic fever, and the L stands for lupus or leprosy. And just so you know, all autoimmune diseases can cause false positives, not just lupus. And the other thing that isn't included in this very convenient mnemonic, but still important to know, is that pregnancy alone can be associated with a false positive. So if one of these non-treponemal tests is positive, then the serum is tested using a treponemal test. These tests look for antibodies against specific treponemal antigens. These tests are usually more expensive and therefore only used as confirmatory tests. One reason these serological tests are routinely performed for screening is because of the difficulty of finding organisms on stain. However, if your patient does have an active chancre, that initial ulcer, is probably teeming with these treponemes. And in that case, you can immediately get a sample and use dark field microscopy to get a quick diagnosis. So how do we treat syphilis? Penicillin G, which is the IV form of penicillin. The amount of penicillin and the route of administration depend on the stage of syphilis, but ideally you would always use penicillin. So what do you use if there is a real penicillin allergy? You use that same drug that we use for Lyme disease, doxycycline. Okay, let's go through the stages of both Lyme disease and syphilis. And now these are both important for your test. So for Lyme, stage 1 is early localized, and you see that erythema migrans, flu-like symptoms. In stage 2, the early disseminated phase, you see bilateral Bell's palsy, or that bilateral facial nerve palsy, as well as AV nodal block. And then stage 3, which is the late phase, monoarthritis of the knee or polyarthritis, and encephalopathy. Okay, now for syphilis. For primary syphilis, what do you see? You see that single painless chancre. For secondary syphilis, you get flu-like symptoms. You get a rash that can involve the palms and the soles and condyloma lata. And tertiary, you see gummus and you see aortitis. And other categories of syphilis include congenital syphilis and neurosyphilis. And neurosyphilis includes that tabes dorsalis and Argyll-Robertson pupil. Okay, so let's get away from those spirochetes and let's start talking about some zoonoses for a few minutes. Now, zoonoses keep my life interesting. Listen, I know that it's challenging enough to learn bacteria that typically inhabit human bodies without the added stress of having to learn the bacterial ecology of every kind of pet, farm animal, rodent, etc. that might be living around you or in your attic. But it does give you the opportunity to awe and amaze your family and friends by telling them the risks of every animal contact that they could possibly have that's casually mentioned in conversation. So here we go with your zoonotic education in alphabetical order. The first one, Bartonella henselae. This is the etiologic agent of cat scratch fever, and as you might suspect, this one comes from the scratch of a cat. It can also be through a bite, and the first thing you see is a little lesion at the site of inoculation, and then lymphadenopathy develops proximal to the inoculation site. It's usually self-limited, so antibiotics aren't always necessary, but it can be treated with azithromycin. Bartonella can also cause bacillary angiomatosis, which presents as these small vascular lesions in immunocompromised patients. In AIDS patients, bacillary angiomatosis can be confused with Kaposi sarcoma. Next is Borrelia burgdorferi. And what does this cause? That's right, Lyme disease. It's transmitted from rodents to humans by the Ixodes scapularis tick. Okay, Borrelia recurrentis. This spirochete causes recurrent fever by varying its surface antigens. It's transmitted by ticks and lice and usually from a rodent. Now, Brucella species. These cause brucellosis, which usually presents as an acute febrile syndrome, often without many other localizing features. Contact with body fluids from infected animals like cattle, sheep, or goats, or consumption of unpasteurized dairy products can spread this infection. This is one potential risk of drinking unpasteurized milk. And there's another reason why pregnant women are told not to eat unpasteurized cheese or milk. Do you remember? Because of the presence of listeria in some of those products. Okay, Campylobacter. Campylobacter causes diarrhea and sometimes bloody diarrhea. Campylobacter is very common in birds as well as pigs. Meat can easily be contaminated with Campylobacter. Next is Chlamydophila psittaci, and this causes psittacosis, which presents with fever and dry cough. This is transmitted by birds like parrots, and it shows up on tests on a regular basis. So remember about psittacosis. Okay, Coxiella burnettii. This is the causative agent for Q fever, which presents with flu-like symptoms and abrupt fever that goes on for several weeks. This one can be transmitted to humans by aerosols from an infected placenta or from contaminated fluid on the coats of newborn farm animals. Ehrlichia chaffiensis. Ehrlichiosis usually presents with headache, muscle aches, and fatigue. It's transmitted by the Lone Star tick, usually from a white-tailed deer. Now, Francisella tularensis. This one causes tularemia. It can be transmitted directly from an infected animal, often a rabbit or a squirrel, or through a tick vector. Tularemia can present in a variety of ways, but the test question usually has a rabbit as the infected animal. Someone has found a dead rabbit, or they're hunting and skinning rabbits, something like that. One way that you can try to remember that rabbit tularemia association is by imagining a rabbit eating a tulip. Another thing you should be aware of is that this organism is considered high risk for use in bioterrorism. Leptospira. We just talked about this one a few minutes ago. This causes leptospirosis, and do you remember how this is transmitted? Remember that this one is transmitted through infected animal urine. Mycobacterium leprae. This is what causes leprosy. The 9-banded armadillo can carry this organism and appears to be the source of some cases of leprosy in the United States, though this does not appear to be the same route of transmission in other regions of the world. Okay, now Pasteurella multocida. Pasteurella is usually introduced into wounds from a cat or a dog bite. This can result in cellulitis and osteomyelitis. So if you see a question about a cat bite infection, definitely think of Pasteurella. All right, now let's talk about some rickettsia. Rickettsia prowazekii, Rickettsia rickettsiae, and Rickettsia typhi. Rickettsia prowazekii is the cause of epidemic typhus, and it's spread by lice. Now, Rickettsia typhi causes endemic typhus, also known as murine typhus. This is spread by fleas. We have some hot spots of murine typhus in Texas, and I end up seeing quite a few of these cases every summer. There's a couple of ways that you can try to remember these two organisms and separate them in your brain. It might help you to remember that there are two I's in Prowazekii and an epidemic, and also the I sound in Prowazekii sounds like the I sound in lice. Likewise, the E sound in typhi sounds like the E sound in fleas. The third rickettsia organism I mentioned, Rickettsia rickettsii, is the causative organism for Rocky Mountain spotted fever. This is a tick-borne illness that can be fatal. It causes fever, headache, and rash. And remember that this is another rash that can be on the palms and the soles. And last but not least, Yersinia pestis. This one is famous for its association with bubonic plague, which is characterized by inflamed and painful lymph nodes called buboes. Of course, this caused huge problems in the 14th century, killing up to a third of the European population. And plague still occurs here in the United States, just on a smaller scale. It's still mostly spread by fleas, but one of the animal reservoirs in the U.S. are prairie dogs. So beware of prairie dog infestations. Okay, now it's time for the end of session quiz. So I want you to turn off the video, answer your questions, and then turn back on your video so we can go through those answers together. All right, let's go through those questions now. What is the classic presenting symptom in a patient with Lyme disease? Remember, presenting symptom for the first phase would be erythema migrans, which is the expanding bullseye rash with a central clearing. What pupillary sign might point you to a diagnosis of syphilis? That's the Argyll-Robertson pupil, and this describes a pupil that is not reactive to direct light but constricts with accommodation. What organism is associated with each of the following clues? Lymphadenopathy plus a new kitten. That is Bartonella henselae, and the organism that causes cat scratch disease. Dog bite. Pasteurella multocida. Now this pathogen is common in both dog bites and cat bites. Ixodes tick. Think Borrelia burgdorferi. Rabbit hunter. Francisella tularensis. Remember that if you see a rabbit on a test question, think of tularemia. And a pet prairie dog. In this case, Yersinia pestis is the correct answer, though I have no idea who would keep a pet prairie dog, really. So that's it for the end of session quiz, and that's it for our lecture on spirochetes and zoonotics. Now just a few rapid fire facts. Number 1, standard treatment for treponema pallidum, penicillin. Number 2, cellulitis from a dog bite or a cat bite, Pasteurella multocida. 3, a non-painful, indurated, ulcerated genital lesion, chancre of primary syphilis. 4, moist, smooth, flat, white genital lesion, that would be condyloma lata of secondary syphilis. And large bullseye rash, and that's erythema migrans due to Lyme disease. And that is it for our lecture on spirochetes and zoonoses. I'll see you next time.